Hi guys, it's Miss Medic here, and today I'm going to talk about proton pump inhibitors. To understand this group of drugs, we must have basic understanding of the physiology of hydrogen chloride acid secretion. And there are three ways in which this secretion is stimulated. This is in response to acetylcholine, gastrin, and histamine. To make hydrochloric acid, both hydrogen and chloride must be present in the cell, and this is achieved by a pump known as the potassium hydrogen ATPase pump, and potassium in the cell is transferred out in exchange for hydrogen to be transferred into the cell. And this is particularly relevant as proton pump inhibitors cause irreversible binding to the hydrogen potassium ATPase pump in parietal cells. And this means hydrogen cannot get into the cell to produce the hydrogen or hydrochloric acid. However, proton pump inhibitors do not inhibit chlorine getting into the cells, but as we spoke about before, we need both hydrogen and chloride to give us stomach acid. Proton pump inhibitors end in PRAZOLE, so we can recognize them readily on drug codexes and when given on the ward. Commonly prescribed proton pump inhibitors include omeprazole and lansoprazole. There are some side effects of proton pump inhibitors, as by reducing gastric acid secretion, they are effectively increasing the pH of the stomach, and this can lead to more infections. And in addition, prolonged treatment with proton pump inhibitors can lead to low levels of magnesium. Omeprazole and clopidogrel interact, and this is because omeprazole is a P450 inhibitor, and it reduces the effectiveness of the antiplatelet activity of clopidogrel. And it's also important to remember that patients undergoing tests for H. pylori bacteria should withhold their proton pump inhibitor for 2 weeks, as proton pump inhibitors can mask the symptoms of stomach cancer. Therefore, it's important to inquire about weight loss and dysphagia and other symptoms before commencing a patient on a proton pump inhibitor. Proton pump inhibitors typically are used for patients with reflux, such as GERD, and for peptic ulcers. If a proton pump inhibitor is given for more than 1 year, it is important to monitor for low magnesium. This is especially true if a patient is taking other drugs which lower magnesium, such as diuretics or digoxin. Thank you very much for listening to this video. This concludes my presentation on proton pump inhibitors. If you enjoyed this video, please don't forget to like and subscribe for more medical videos.